In order to maintain the safety of the drug supply, drug testing and then legislation has to be addressed. All drugs must be thoroughly tested by the company before marketing according to the Food and the Drug Administration. There's testing to determine the drug's effectiveness, whether it's safe or not, and this is a very time-consuming and expensive process. It involves the development of the medication, testing the medication through computer models, then through animal models, and then through human clinical trials, then getting to the actual manufacturing, the eventual marketing. You have to realize that there's thousands upon thousands of chemical combinations that can possibly be therapeutic to biological critters such as us. Finding one of these to fit is a very trying process. Eventually, if all goes well, the drug gets to the FDA. When testing, there's chemical and there's animal testing. You should know the term in vitro. In vitro is Latin for inside of a glass, and you can kind of consider being inside of a test tube. These are done for chemical analysis. These are done through laboratory test tubes. In vivo testing is Latin for in living, in other words, in living critters, and this is when we use animals to test. The animal tests happen before human trials. They're looking for the toxic effects of the medications, if there's a potential or a possibility of addiction, that is habituation, if there is the presence of abnormal growth, that is, if these start triggering tumors in cancerous growths, if there is the possibility for fetal deformities, and a study of the pharmacodynamics, that is, how the chemical is absorbed, is distributed, and eventually eliminated from the body. Pharmacodynamics is a way to describe how fast the medication takes effect. It's involved with how fast the body takes things in, how quickly the body distributes it, and how quickly the body is able to eliminate it. If the body is able to absorb the medication faster, then it makes sense that that body would feel the effects of that chemical even faster, and vice versa. If it's a slower absorption, then the body will not take the effects as quickly. As we go through, you will see that there's various ways to administer these medications. These ways of administering medications affect how quickly all of these pharmacodynamics take place, whether it's absorbing the medication, whether it's distributing the medication, the liver changing or metabolizing the medication, and then eventually the body through the kidneys, liver, the GI system, and the skin eliminating the chemical from the body altogether. The graph behind me shows how easy it is for a chemical which on one hand a certain amount can be therapeutic, that is, cause and effect where a person has less of the symptoms or the disease, and can easily be causing death because of a toxic level of that same chemical. So it serves us to be very, very cognizant of the effects of the chemical on this biological being. One of the terms that is important to remember is called half-life. Half-life is defined as the time required for the drug level in blood to decrease from 100% to 50%. This can be prolonged with certain organ dysfunction, particularly liver and kidney disease. This affects the metabolism or the elimination of that drug, and that will directly affect the half-life of that drug. The shorter the half-life, the more frequently that medication needs to be given. When we're talking about pharmacodynamics, one of the things we need to mention is a concept called the therapeutic index. And this refers to a safety margin, a measured safety margin, where if the amount of chemical in the bloodstream is higher than the therapeutic index, that is considered toxic or poisonous to the patient. And if the amount of that medicine in the blood is below the therapeutic index, then we know that there's simply not enough of that medicine to make an effect, and we call that subtherapeutic. Now, how do we find these? How do we find these margins? Well, it goes back to the animal testing. We have to be careful here because it's not uncommon for us biological beings to become quickly toxic or subtherapeutic. In fact, one of the medications we currently use, called digoxin, is notorious for either being subtherapeutic or toxic, and the patients who are on those medications need to see the laboratory frequently in order to get their blood tested. As the chemical is being developed into a medication, therefore, it is sent to the FDA for the animal testing, and the FDA will complete that. In addition, the manufacturer will start to ask for permission to give the drug to humans. As the information from the testing is gathered, information from the animal studies is gathered, and it is put together with information about how that drug is manufactured and how that drug is to be stored and the specific chemistry on that drug. If all of those things happen and safety is still being maintained, then the drug, and only then can the drug be sent forward to clinical trials or human trials.